I'm Ammar Al Chalabi and I'm a Professor of Neurology and Complex Disease Genetics at King's College London. I've been talking about whether a robot can be a genetic counsellor. And that's because at the moment it's neurologists who do most of the genetic counselling before somebody has testing if they have motor neuron disease. But that takes up a lot of time and also makes it difficult for the person to ask the questions because it may be a very restricted, rushed appointment. If we have a robot genetic counsellor that they can access in their own time, then that would be a very useful thing to be able to do. But there are a lot of obstacles to overcome, particularly around making sure it's safe and it has the correct attitude and tone to deal with difficult questions that people might ask it. So the reason we need a robot genetic counsellor is when somebody has a genetic test, it's not like having a normal blood test. With a normal blood test, you literally go to the person, they take your blood and it goes off to the lab. With genetic testing, because there are so many implications of a positive test, a negative test, or an uncertain answer, the person needs proper counselling beforehand, which can take about 30 minutes. For somebody with motor neuron disease, we like to do that ideally at the first appointment or one of the first appointments. But the very first appointment, they've already had a long time with the doctor, they've had a lot of information given, they've had a life-changing diagnosis given to them. It's difficult then to really be sure that over the next 30 minutes somebody's able to take in the additional information. So having a system where somebody can have the genetic counselling before their genetic test in the comfort of their own home when they want to do it, and take the time to speak to family, friends, and ask the questions that they need answered, that's a very useful thing to be able to do. So we're hoping that this will be a supplement to a doctor also being able to give genetic counselling information. So the person can then go back to their appointment with a certificate saying, I've been counselled and here's a transcript of the conversation, so the doctor can then check what's been said. So the most important future issue for genetics is understanding how to make treatments that are effective for genetic forms of motor neuron disease. We know it's possible. About 2% of people have a change in a gene called SOD1, and we know those people respond to a genetic therapy called tofersen. But about 30% of people with motor neuron disease at least have some genetic change that's contributing relatively significantly or very significantly to their risk of developing disease. And so if we can make a genetic treatment that targets that, then potentially you could dramatically treat at least 30% of people with motor neuron disease. And also, that would also allow the possibility of screening people from a family. If they have the gene, potentially you could prevent the motor neuron disease ever starting if you had an effective therapy that could be given early enough. There's several advantages to having a meeting like today's. The first is that if somebody has a family history of motor neuron disease and then they're given that diagnosis, it's a significant piece of information to carry and you can feel all alone. But having a day like today where many families come together, it means that you understand you're not really alone. Actually, there's lots of people who can work together to tackle the problems that you might face, and you can learn from each other. Doing that with clinicians and other healthcare professionals and scientists means that the scientists and the healthcare professionals can actually learn from the people who are affected, who are living with the impact of having a diagnosis of motor neuron disease. It can do things like, for example, my genetic counsellor talk. I was able to learn interesting things that are important for people with motor neuron disease that I wouldn't have known about otherwise. So having that two-way interaction, of course, people who are diagnosed need information from their clinicians, but equally if we're developing some new technology or treatment or just different approaches, it's important to have the information for us from the people with lived experience.